After battling addiction for years, 19-year-old Tyler Shamish was hospitalized for a suspected overdose. But inexplicably, his drug test came back clean.
I asked the doctor 3 times. The doctor's like, no, our tox screen would show it. We test for opioids and it would show fentanyl.
The next night, Tyler took another pill laced with fentanyl and died. Shockingly for Tyler's family, regulated drug tests in emergency rooms are only required to check for what's known as the Federal Five: marijuana, cocaine, amphetamines, opioids, and PCP. Fentanyl will not show up. Many doctors and labs are unaware.
Do you think it's irresponsible that hospitals across the country don't automatically test for fentanyl in a drug screen?
Extremely. I think because parents, you trust doctors, you trust hospitals. And if they're telling you that your kid's tox screen came up clean, most parents aren't going to think to even question the doctor.
Julie found purpose advocating for legislation in California to require a 6th test be added specifically for fentanyl. Called Tyler's Law, it took effect this year.
California is the first and only state that requires fentanyl testing be added in ERs, something advocates hopes expands nationally at the low cost of just 75 cents per test. Dr. Ronit Lev partnered with Julie on pushing the legislation through.
It is simple. Every hospital in America could do it tomorrow if they wanted to.
Josh Symes is one of the tens of thousands of Americans who died from a drug overdose, a majority of them suspected to involve fentanyl, according to the CDC.
It turns out the hospital had not tested for fentanyl.
His partner, Melanie Yates, testified on behalf of passing legislation in Maryland to mirror California's law.
We're undoubtedly going to have more overdose deaths because we're not testing for this. How are we going to make an impact if we're essentially blinding ourselves to what's actually going on?
How often do you see patients that test positive for fentanyl that didn't know that's what they took?
I see that all the time, every single day.
More than 50 million fentanyl pills masquerading as regulated medication like Xanax or oxycodone were seized by the DEA in 2022. This kind of testing is essential for unaware patients.
When I tell them that they're positive for fentanyl, I could see their eyes light up. Now they may want to change or do something differently.
My son could still be alive today had the doctor known. Not even had they tested for fentanyl, just had he known, because then we could have gone and taken him somewhere else for testing.
An easy, low-cost test that could save lives and pull back the curtain on the scope of this national epidemic. Maura Barrett, NBC News.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.